Welcome back to the Smart Life. The pandemic has taken a toll on all of us in so many different ways. And health leaders say we may be in need of mental and physical rehab. So, joining us to talk about all of this is Lisa Corsa. She is a doctor of physical therapy and a wellness expert. Thanks for coming back on the Smart Life, Lisa.
Good morning, Olga. Thank you so much for having me. It feels great to be back after all of this.
Tell me how you're doing before we talk about all this. Has it been tough on you and your patients?
Absolutely. It's definitely been a difficult road. I'm really seeing an influx of patients now with all of these new musculoskeletal and mental health impairments.
Absolutely. And I want to talk about, just the fact that we've been dealing with so much mental and physical issues. What are you seeing in your practice? We're hearing a lot, and I'm going to read some of them that I'm focusing on here: weight gain, the inactivity, just the fact of being on the screen time so much. What are you seeing besides that, Lisa?
There are so many new impairments I'm seeing:
Mm.
musculoskeletal, neuromuscular, and even the cardiovascular system. Patients are coming in with new joint pains, a lot of swelling from inactivity. They barely can walk from A to B. They've got shortness of breath. So it's really interesting. There are so many studies on the deleterious effects of inactivity. I will tell you, arthritic flare ups, their autoimmune conditions have now really gotten more inflamed. Low back pain, a big exacerbation of low back pain because everyone's sitting with Zoom calls. No one's really getting up and walking anymore. And more people are on their screens, iPhones and computers. So a lot of neck pain, shoulder pain, frozen shoulders. It's really interesting what's coming into the office.
And those are the physical aspects that you're talking about. Now let's add the mental aspects as well, because all of that pain then leads to, I would think, sadness, depression, anxiety.
Absolutely. There's no question that there's a direct correlation between lack of physical activity and all of these symptoms we're feeling due to COVID 19. It exacerbates them. The fear, depression, anxiety can make the physical symptoms worse. And clearly, when you're trying to recover from an injury, if you have these symptoms, despair, stress, fear of the unknown, these injuries and pains can lag on. You don't heal well. Your muscle tissue doesn't heal well. Your skin, the tissue, the swelling. It's very interesting, but multiple studies in the journals of psychiatry relate the deleterious effects of physical inactivity to anxiety and depression for sure.
I will say, and I'm very open about my life with so many people, I can be a very anxious person when certain things occur. And one of my outlets is running. And I get that runner's high, the adrenaline gets going. And I know it has helped me in so many ways in my life. So, what can people do, Lisa, to get back into shape, not just physically, but mentally and spiritually?
I would suggest top three things, Olga. Every day, just like you said, make it a point to either go running, a brief walk. It doesn't have to be long, 20 minutes, but get out in the fresh air. That is a key factor to actually now start to get out. Walk on the beach. You can still be safe walking outdoors. Another thing is if you're going in to visit a grocery store, park in the farthest spot. So this way you can get a longer walk. Move your feet. Don't just park right away in the closest spot. Activity is key. Another thing is if you're sitting there doing Zoom calls or your Zoom meetings, stop sitting for more than 30 minutes. It's really bad. As I always say, sitting is worse than smoking. Definitely get up, get a stand up desk, move around, set your alarm so you're not sitting at a computer in these meetings all day long. And then practice mindfulness, some form of meditation. It doesn't have to be a formal meditation, but it could be just breathing, diaphragmatic, actual breaths that you take consciously. 10 or 15 breaths in the morning and in the afternoon can really help the mental clarity. Highly recommend that.
And I would think, Lisa, in terms of what we talked about a few minutes ago with the depression and the anxiety and the grief, this can help not only adults, but children as well, because children have suffered through this pandemic in so many ways.
No question, Olga. According to the CDC, 91% of school age children were affected by stress, anxiety, fear, and depression due to school closures. They're not at sports anymore. There's no social interaction. So I'm really actually seeing in my clinic these childhood injuries such as scoliosis,
Mm.
knee injuries, they've gotten worse because their back or their neck, they're not moving. They're not playing sports anymore. I really have had an influx of low back pain and neck pain on school age children. And then they come in and they're fearful they're not going to get better. They're afraid that the new injury is worse than ever. Their pain is actually heightened at a new level. These symptoms that I'm hearing from kids are different symptoms. I have severe pain, Dr. Corsa. It's not getting better. They almost have this fear they're not going to improve. It's quite interesting.
And you and I once did a wonderful segment on a patient of yours who was going through so much. I believe he suffered from paralysis. Patients like that, not only just this individual, if you'd like to recap his story, but all individuals that were looking forward to seeing you, other doctors as well, not being able to. And now that finally the doors are opening, things are getting better, but there's a lot of fear moving forward. Have you noticed that?
Absolutely. The young boy that I started with, we talked about, he's now 21 years old and he suffered full
Oh.
paralysis. He hasn't had
Mm.
any formal therapy in a year. In fact, he's coming down next week to visit me in my clinic for a full reboot, musculoskeletal, neuromuscular, and mental health. He's so stiff, his joints ache him, his muscles have actually altered. They've changed. They're tight, hard. He can't really move well. I'm seeing this in many of my patients that I actually go and fly to now and visit. They are completely, impaired on all aspects. Their depression, and they're not even seeking mental health. They're afraid to
Mm.
go and see that. The fear has definitely caused a multitude of factors. So I'm really trying to push people to say, get out now. It's safe. We are vaccinated. Our clinic is clean. We can improve your health. Don't be afraid. And that's what I'm really here to encourage people because it's only just going to get worse the more inactivity you do. Truly.
And I know you travel around the world helping people everywhere. You're constantly on the go. This must be so fulfilling for you. It's going to be a challenge, I would think, after the amount of time we've been through. Any words of advice for? I'm always the one that uses the word hope. In Spanish we say esperanza, hope for the future. What advice do you have so that we can hopefully come back to what once was?
Absolutely. Believe it or not, I'm actually flew out right now as we speak for a family to take care of. And they are
Mm.
suffering the deleterious effects of immobility, inactivity, mental health breakdowns. So, I think it's going to take longer, as I told this family, that you're not going to get better in a week. We're looking at several months to get people better. So you can't lose hope. The brain and body can heal. Hope is a vital emotional state of mind. Having this important hope will improve neuroplasticity. It improves your brain pattern. We know that physical activity can promote neurogenesis,
Hmm.
angiogenesis, which is cognitive wellness. Physical activity can improve your brain and absolutely your body. So I'm here to give you and all of the patients that are listening that you've got to have this sense of hope. You will get better. When we start moving, you will see that the brain fog and fatigue and malaise will go away. Some interesting statistics on COVID 19: greater than 91% of people that suffered COVID 19 have that recurring, lingering symptom of malaise, fatigue. We're calling it long haulers syndrome. They're feeling
Mm.
this sense of ache and pain, and their brain is foggy. Physical activity and getting out and moving with physical therapy can improve you. It will. There's no question. You just have to make that move to get out of your house and not be afraid. So we all need to have that sense you will get better. Don't lose hope. Find your local doctor, therapist that's really going to motivate you. I'm actually doing more Zoom calls with people around the globe. I'm getting them to stand up, march in place, get out of your chair 35 times. And let's talk about nutrition.
Mm.
We need to, for sure, do a refrigerator renewal. Clean out all the junk that's in your refrigerator. Stop eating the bad food. Focus on a well balanced diet. Get rid of those pandemic pounds. You can do that. Absolutely.
Thank you, Lisa. It's always great to see you and see that beautiful smile that you have. Appreciate your time.
Thank you so much, Olga, for having me.
We'll see you soon. More Smart Life after this. We'll be right back.